I've developed a lot of drugs, and it takes a long time and a lot of money to do it and a lot of effort. But let me just start. The whole process is highly regulated. You have many, many, many rules about what you've got to do. For example, first rule is when you make it, is it safe to put into human beings? You have to write down where you got your water, where you got the salt, where you got all the equipment, how you clean the equipment. And then people come and inspect it to see if you're telling the truth. Then once they've done all that and you show experiments that say, yeah, this might work. We think it works in animals. Now we're going to try it in people. They have a three-step process. First, give a little dose to a few people and see if it's safe. Then give a bigger dose to a few people and see if it's still safe. Then give a bigger dose. That's step one. So if it's safe in those things, then they say, okay, step two. Now let's try to see if it's safe for more people. That's called phase 2 or step 2. And that might be, so the first group may be 20 people. The next group may be 200 people. And now you're looking not only to see if it's safe, but because the people you try it on are perfectly healthy to begin with, now you're dealing with people who might have the disease. So you're looking for it's safe in those people with the disease, but also does it do a little good? That's called phase 2. If it looks like it's safe in people with the disease, now you're dealing with 200 people, then you do what's called a phase 3 study. That is a big study, and it depends on if there are going to be 1 million people taking your drug, you might have to do it on 10,000 people. And then you're trying to see, does it work? And is it still safe? So it's a long process, and you have to prove at every point. Not only do you have to make it very carefully, but you have to keep absolutely clear records. So you know who's got it, how much they got, exactly what happens, and you have to pay for all of their care while you're treating them. You have to give them total care and pay for all that. And it can cost up to $50,000 per person. Multiply 50,000 times 10,000, and you've got a lot of money you have to spend to get it tested. Once that's done, you know it's working and it's safe for 10,000 people, then you can sell it. Okay. And then there's something called phase 4, or different groups have it. Once it's out there in the world, you have to keep looking to see if there's any bad things that are happening. If they are, you have to report it and try to understand it. So some drugs, even after they're approved, turn out to have, when they're used on, instead of 10,000 people, 100,000 or 10 million people, have some bad side effects, and you have to take it off the market. So there's a whole regulated process. That's why, and it takes a lot of time, it takes a lot of money. Now, during the early AIDS years, there were people who were dying very fast, and they said, you guys are taking too much time. You know, we're just going to go ahead and test things ourselves. We're not going to follow all your rules. First thing that happened is they used drugs for a lot of people, and they died. They died right away, and it was their friends that died. After that, they said, well, maybe you guys have a point. Maybe you should be careful. And we started to work together, and they actually helped make the process a little faster.